Thank you for allowing me and us, Dana and John, and to be a part of the community. And well, Tom, I, Valva, and a number of the members of Krista, there's Krista, thank you, Krista, who have worked very hard to bring some of the community members together to talk about what we're doing at Nakoda. And Nakoda is a center which you may have heard will change from tourism and hotel destination spot to a health center. And Nakoda is perfectly located for a place of healing. It is, the power of Nakoda is strong. You all know this when you visit. And we wish to blend and bring together with Chief Wesley's blessing a traditional healing center and a center for blending with Western medicine. And we're working with physicians and other specialists, like Tom said, physiotherapists, occupational therapists, and psychologists under one roof. But with them, with us, will be traditional healers and getting back to the roots of healing within your community. As an outsider, I welcome and look forward to learning what is out there in traditional healing. As a physician, the goal is to see that not just our elders are treated well and healthy and with the respect deserved, but also we have healthy youth for the future. And we need your guidance, we need your wisdom to help us as we embark on this journey towards trying to provide the youth and those that suffer from the loneliness of not knowing where they are or who they are. We look forward to working with you and your advice in trying to get people back on that path of health, wellness, and purpose in life. And this is not done by any one person. In medicine, we don't work in isolation. I'm a specialist in medicine, and we work with full teams of people. And those teams involve not just the individuals I just told you about, but also the healers, also acupuncture, also massage, also prayer. Those are all important aspects of healing. And we'll bring all of it together under one roof as we try to work with the community and with those in need in seeking new purpose in life. Prescription drugs are a problem, and at the same time, we'll work with the doctors on the prescription drugs so that anybody who has this as an addiction, we can manage it. We can help with the prescription drug problem. Some people need medications. Some people need drugs. There's a purpose for everything, but not everybody needs them. And sometimes we start out taking a pain medication when we have a back injury or a neck injury or an ulcer from diabetes or the nerves don't work well. That's a very good purpose for prescription drugs. And so in those cases, it's not a matter of stopping prescription drugs. It's a matter of making sure that you have the right drug at the right time, and so you don't get a need to take more and more and more. And traditional healing and herbs will help because they both work together in giving good health. So our goal at Nakoda is a long road, is a long journey. When people come to Nakoda, it won't be just 1 week, 2 weeks. It may be 2 months or 3 months as we regain our health back again. That has to come from you and the support from the community and the elders in the community. And so we do seek your advice and your wisdom. That's really what I wanted to say today to you. If you have words you wish to say, then we're here, I'm here, and I welcome it. My apologies that I absolutely have no idea how to speak Stony, and I even have difficulties with English. So I will turn it over to Tom, who will help me along the way, and do seek your guidance and your thoughts as we're here today. This is why we are here. We will have other meetings and other gatherings to try to bring elders and youth together, and maybe through that exchange of discussion we can learn even more. So I hope that helps with understanding Nakoda Lodge. We hope to have the doors open in a very short period of time. We hope that it will bring employment to the community, education to the community, and purpose to those in need. Tom.
Thank you, Doctor. I just thought Helper High the Delta Namis. Jenny is the Suwashipu Jayapsan, the Hanging Ham to Dako, so Bedlam. Then engaging on this engaging hobby, figure, but you can't get this in touch. So I'm getting engaging in Dabi. The judge are going to Dabona. It's in India. The Sun Helper High Jayas, but China, Sindar, Gold Copy, Yalahan, Hande. It's a little bit only. Oh, Doctor, we are not they got to.
Oh, okay.
There's Jan.
When you are not the chief. When you're hungry, nobody else is not paid that one. You might have just to run out. Yeah, my special to run out. Shake high, I have a day, John, my small year.
Zay namin yap siya.
Kasi daw ay nanay no mais iyes ka. Daw ay nanay no kito siya.
Zay muin niya bize ko. To kini ngaya minta. Zay yung nas siya siyap zewa. Kaya to kini pamilya kam sasta yes ka hangin desne yes ka jena hingyan. Say just me you sing touch it, Japanese. Yes, Kahandina. That's a Munjahan, Chimias. Yes, Kahandina. Ching go, Ching Yap, see. That was to convert. I yap zena, kecing yap zena. That's a very nice to kill biga. That's a hit as a kogo ching yap sem. As if the ashes so up in those very happy. Sitting could be no what that's all facing could be single yap. Ching yap is she has got ching yap to the one. Down looking down, Mida is got it. Now I see to is non taste ne go via picture, non taste ne one Hana. It's a quiet picture. Since is yet no yap time. That's why I see to there. That Sunday, both charming each year, Nangin, it's saying, yes, check up there, thoughts immediate. It's saying, I you down thoughts in on Ningidas is okay, but thoughts you must did not. It's a guy watching any night which I say, yeah, gives me now. Just very late, it's a big you are. Check up is, yeah, you have someone, yes, it's no pick up someone. It's trying, yeah, no pick up what. I check you violated where your manga may hit us. Children up. Got to don't sneak think ya bitches. Just in case is no one not in eating. Now he's then does not travel in. It's outside Kubona, ya what. It's a look, they are Manchati is as they could be peace at Nakoda. So hang in yet to case the Hanka Yahan. The which I like touching that piece coming piece. Thus then stats, it was that's okay. I guess I'm not yabi. John Kianda, way to Kianda, way to get you ticket. Sanda, I guess I'm not yab. I guess I'm not it. I guess after overdose himself. Plus the photo overdose him Yamina as Quachi was natural death and what naturally what. About the winner prescription drug overdose that. Siko basta vidya not it was saying in your outside. It's it's anime yeah,
my answer to that question is right now it is conflicting. Trying to do it our traditional way and following the white man's counsel. It's going both together. It's conflicting because we don't know which to believe. Did you elaborate on that?
Yes. It's a very good point. Because Western ways are different than traditional ways. My specialty has one purpose, and that purpose is the patient, the person. So I will give advice. My staff and my colleagues will give advice. They can be therapists and psychologists and social workers. However, as a whole, we only are there for one person, not for me, not because of them, but because of you, the patient. You're the one that needs our guidance and our education. Traditional healing would be the same way. You serve people. You have different ways of serving people, but good health is the common ground for all of us. And so we all want the best for that person. And some days, people will need the wisdom of traditional healers only. And in other days, they may need a little bit of Western medicine. And then if they have a physical injury, they may need a lot of Western medicine. But it's only there for one reason. So in a room like this, traditional healers and Western healers are sitting at the table, coming up with a plan to help people, talking to each other, and coming up, and traditional healers will challenge physicians and say, don't give that medication, that's harmful. There is another way. And the only physicians that will work in this team are the ones willing to listen. And we have to listen. I'm you know, in my 60s, I'm at the peak of my career, and I have still much to learn. And I don't have ownership over people. So I also have to learn from healers and from those that know more than me. Because I only exist because of that patient, that person. And all of us are here for that one reason. So we have to bend with the wind some days. But it is a good point. In treating addictions, or in treating loneliness, or in treating you know, the emptiness of life or the pain of life, if you work in just a Western model, you see what happens. It doesn't work. It doesn't work. If we work in just a traditional model, then what happens when we leave the community and go to the cities? We're faced with Western models. So we need to learn about both, and both have to know how to work together to bring out the best medicine for that person. And we all need to work and grow together to do that. And so healers are working together, growing together to provide this treatment for people, but they're also in that process of learning. And is it new? Yes, it's new, but it's welcomed because people need to understand the gift that healers have and the gift that some physicians have and some psychologists have. Nietzsche has. Those are gifts. Those are gifts to help us have purpose in life. And we will all listen and learn.
Trên those name maybe you can see you with it. I'm just those about this month. As you did the just done it. Hangya look at Chahanga chasing out engaging where you have no meaning age of Chachako. It's another chasing those those get up and those topics but using go business. Together in going Chigiabis is Nini Chia, which is the
My wife, she teaches animal therapy. We know that animals and the spirit of animals help heal. And she works with horses and dogs in that healing process. And we've all seen the impact of good health that comes along with therapy derived from just the spirits of the animals around us. And if you talk to some physicians, they would think that's silly. Here, take, this will help your pain. And those kinds of clinicians can't be involved. We all have to be willing to learn the importance of different ways of helping people.
And then Nunca, they got to ye Jones. It's not in the Nakoda, but down the rest in Kina. In Basta, non-Takia, Don Jones. They just said the magic time, Tapi, Yazam Pilda, Ujabi Pilda, Dana Heta, Marva Hiabis, Noahetas, Jace, Jane Mukiabi. Setas, yes, no gate and Madunas, Aberhi, Kubitas, Kopia, Joe, Nehis, Tosa, Nintekiabi, Saint Kubitas, Hetches Hangai. Could it down Pias go down Congo Nabsi? Tosa did not be chapter. Says, is to Kankan, those non brains by a long period to issue high heads. Those by Nixie. That's you happy guys. dễ quả chín chín mình chả chết không má mình à
mấy ông mấy để chết hàng nào gì đâu chẳng tôi bên tôi này nó biết uống trà bia gì chín là biết sẽ tôi nói là sẽ uống cái gì kalau kita terlebih cakap kau sih fokus kamu station ni sih yang kudu cakap yang tolak cakap kalau bisa mana sih orang cakap 50 years ago now我讲的这样现在我差不多是啥Kaki, let's preach the jet. Toa gozuna, toa perda chastabne shogata. Se stana umyato pechimcha. Что надо спецчакьявче, о чакьявна station. Де объя надо нас не чьявит. Он явно стишь, Шеханда молишно. Это и это. И те кошки не гнат чокешн.
Cái được. Là khi mình nói chuyện mà có thể just yên chỉ nói ra. Yes, chỉ mas là những cái kiểu mình để tao mà đối ra. Itu kan ayah bisnis na heci ngak doken loya bihan ngak ide amin tachi mangya ken
ya agi peno then this come the government course washing this pencha kya lecha no man to pencha shena ko ga monji chaya shekya ye shekya ye shu man to Não já está no coach,
nên ông nhìn có được ông đi chắc thì vào đi Lana part thì đeo chặt yes cả cái chắc thì đeo chắc cả và khi lúc tới đeo chắc cả rồi nó thì đeo chặt Lana part thì đeo chặt yes cả James is chỉ pingi chắc biết chặt was focus James man focus Sensi sa hiata, is peluang casta, is wala mau situasi sekian. Jeko tinggi cawik cah. Selama kau dah bermakan billing senanis, seni si dona jenis, jenak contact sama isi. Sensi si soal makan. Kau secik je, jadi so tinggi cawik cah.
The goal eventually is that First Nations members of the community, there's no reason that the skills to be the physicians in the community and the skills to be the therapists in the community and then knowing traditional ways, that is the goal. And the ultimate goal is to have First Nation clinicians who have knowledge of both. And that may take a generation or two, but that is the goal. And the goal is to bring traditional healing at the same level and give the opportunity for the community, for the youth to become educated in these areas and these ways that are of interest to them in healing. But the one thing that we in the West, with our prescription drugs, have messed up is there's a Latin saying, and it's "Previa non nocere," and it means first do no harm. Well, we sure have. The prescriptions and the repeat prescriptions have done harm, and that's why we have to pull back and learn other ways of treating, so that we can help on the road to recovery.
Case where you each other, among those communities on China and Navis, those are not good job on those computers, Kitty Honey, Kijabita. Next week Tuesday, so community now Wednesday, those windows in coming up. Wednesday, so yeah, next week. But just don't copy it. So give it young king yabitas. Yepis are any yabita. The Janan was awesome by the Jabon West. Jane got for Johnny Jabis here. Okay.
Nakoda launch maybe that's the one that Nagamas and is Nitibita. If Nebi said you want to know Tashka. What should do? I was gonna Tapejudane. She knows harm Pistane. Nagum the Hejabi that was stable. She knows is Nimita by Angayami. He's looking Chaname. And yet, I want to be done. In that, all the hand and the cabinet not be I said, Washington proper protocol, everyone. In Donish, why you jump in a hetaka, in Don Gubina, Ungogia, and then what you got. Now, Tabinane, Zewa, the Munina is it. Nish wasn't now one. Now, Tabina, the Wagonia, in the Munina yet. And then in the cabinet.
Thank you. We have a gift of tobacco snuff for you for coming, and we look forward to seeing you again the next time. Thank you.
On snuff, tu veux qu'elle prenne?